Hello, everyone. Greetings of the day. I'm Sayukta from Beautiful Spotless Skin Team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They look like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across four Indian cities, reveals that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. And around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma sufferers have been misinformed about aspects of this very common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know about sunscreen and melasma from an expert. So let's connect today with our skin expert, Dr. Aakanksha Juyal, live from Lucknow to talk on sunscreen and melasma treatment. Dr. Aakanksha is a consultant dermatologist at Skin Cure Clinic, Sector K, Ashiana, Lucknow. She has 14 plus years of experience in dermatology and cosmetology. Her special interest lies in treating acne and melasma. She has vast experience in chemical peels, microdermabrasion, laser hair reduction, vitiligo treatment, etc. And she is also a lifetime member of Indian Association of Dermatologists, Venerologists, and Nephrologists. A very warm welcome to you, Dr. Akanksha.
Thank you for having me over, and it's my pleasure entirely.
Mhm. So, doctor, today we are talking about a very common condition, which is melasma, and it is so, so easy to say people, especially women in their 40s plus ages, to have melasma or this hyperpigmentary issue. So, it's very important to talk on this and spread awareness over melasma. So, to start with, we'll first like to ask you, what is melasma?
Yes, it's a very important question because most of the times people are not aware that they are suffering from a condition and they tend to self medicate. So, melasma is a chronic pigmentary condition of the skin. It mostly affects the face, especially the forehead and the central area of the face. It is most commonly seen in women, although very rarely it can also be seen in men, and it is more common in the Asian or the Indian subgroups, like when we say in skin types 3, 4, and 5, uh, partly because we are more exposed to the sun rays, ultraviolet rays here, and maybe also because of lesser use of sunscreen. So, melasma, yes, is a chronic pigmentary disorder of the skin, especially affecting the sun exposed area, especially face and sometimes forearms also. Yes.
Right. So, sun exposure, sun rays, or the harmful radiations emitted by sun is the main culprit. But are there other causes as well from melasma?
Yes, there are other causes. So let's talk about the causes now.
Yes.
First and foremost, hormones, especially the female hormone estrogen, predisposes women to melasma. That is the reason we see melasma more commonly in pregnancy. Then we call it cloasma actually. So cloasma is a condition, it's melasma only or pigmentary condition of skin during pregnancy. So it is more common in pregnancy. Women get it during menopause, like when they are undergoing those changes where their periods are about to stop. In those times, they tend to develop pigmentation over their face. So, pregnancy, menopause, even women who are taking oral contraceptive pills, and sometimes post-menopausal women who are taking hormone replacement therapy. These women are also, sometimes prone to get melasma. Rarely, as you mentioned, around 10% of the men also get melasma. In them, it might not necessarily be because of estrogen. It might be their predisposition and, lack of skincare. Sometimes there are certain medicines also which predisposes one to have melasma, but that is a very small subgroup maybe.
Mhm. Okay. And Dr. Melasma is a term which the people or layman is not so aware of, but pigmentation is something which is quite,
Yes,
as a term, famous. Now, many
yes.
times people confuse, are they the same thing, melasma and hyperpigmentation, or are they different? Would you like to shed some more light
Yeah.
over this?
So, see, hyperpigmentation, when we say hyperpigmentation, we mean that there are places on your skin which have more pigmentation compared to the normal skin. So, there can be many reasons for hyperpigmentation. It is not just because of melasma. It can be a post inflammatory hyperpigmentation when a person has had some burn, some injury, which is followed by a darker color or a darker patch on the skin. It could be acne induced hyperpigmentation as well, wherein when the acne resolves, it leaves dark spots on the face. Yes, another very important condition as we are discussing is melasma, but there are certain other conditions also which cause hyperpigmentation, like Addisonian disease, I mean, there are n number of things which can cause hyperpigmentation. So we should take it like this: just as someone has fever, fever may not always be because of typhoid. It can be because of dengue, it can be because of malaria, it can be a viral fever also.
Mhm.
Similarly, hyperpigmentation is just a sign, it's just a condition. It can be caused by various things. One such thing is melasma.
Right. So hyperpigmentation is a broader term, we can.
It's a broader term, yeah.
Yeah. And doctor, what are the signs or symptoms of melasma?
Okay, so predominantly the main sign or the main symptom with which the person comes to us is brown or dark brown patches on their skin. And these patches are very obvious because they are mostly on the face. Like mostly we see melasma on the forehead or the central area of the face, like the cheeks. So the first and foremost symptom is like dark colored patches, brown colored patches. Sometimes they may complain of associated photosensitivity. They may say that when we go out in the sun, I get itching on these patches. Sometimes they may say that we have redness when we go out in the sun, but they basically come with these brown patches. So this is the main symptom.
Right. And doctor, you have already mentioned that pregnancy is a risk factor. Pregnant women do many a times get
Yes.
melasma, or
Yes.
there are so many other things. We would like you to tell us more about the risk factors for melasma. Who are at risk?
Okay, so see, in our clinical practice, I have seen that the first thing which predisposes one is also the family history. So, if there is melasma in mothers, the daughters are bound to get, and if sometimes not the mother, there is a strong familial association, then people are bound to get melasma. Also, as we said, pregnancy is a time for getting melasma. And if there is, people don't take care of their skin during that time, and they are using not using the prescribed creams for their skin, they
Mhm.
can get. Also, young girls who are on any form of hormonal therapy these days, we know that teenagers and girls, they are suffering a lot from PCOS,
Right.
polycystic ovarian syndrome.
Mhm.
So these girls are at the risk of getting melasma because there are hormonal ups and downs, turbulences in the body. So this predisposes them to get melasma. And also sometimes when an oral contraceptive is given to treat PCOD, that itself could cause melasma. So these are basically the risk factors:
Mhm.
pregnancy, familial predisposition, then hormonal imbalances, including polycystic ovarian disease, and the treatment for PCOD itself. All these things can predispose one.
Right. Now, as you also mentioned initially, that the biggest, problem in our society is that over-the-counter medication is so easy.
Yes,
It's easily accessible and available. Then we
very.
have home remedies. So now, what we as laymen normally do, when we see these marks, spots, patches, rather than going to a qualified doctor or a dermat, we try to fix it through some home remedy because we really love home remedies. Then we have over the counter medication. We'll just go and ask the chemist to give some cream, which we apply. And initially, that cream do work, wonderfully, and we fall prey to that. So first, we would like you to focus on the use of home remedies. Are they of any use, or we are just wasting our time and energy? And then we'll talk
Okay,
about over
so
the counter medication as well.
here, see, there are no, there are no trials or something on which we can base our answer. But my experience, as I would say, that home care remedies would never remove melasma. That is the first and the foremost thing, because melasma is not very superficial. As we know, there are two, like dermatologically, there are two types of melasma. It can be epidermal, it can be dermal. Epidermal is still in the more superficial layers of the skin, but deeper dermal melasma is very resistant to treatment. So, no form of home remedy can remove your melasma. At the most, if you're using something like curd contains lactic acid. So, if you apply it on your skin, it might have some form of superficial peeling effect on your skin. And when you use it, you might have a glow for a day or so, but it's not sufficient to treat your melasma, to remove your melasma. Okay, so there are, as I said, n number of home remedies. People would say, हमने aloe vera काट के अपने चेहरे पे लगा लिया. So, I mean, the raw aloe vera gel is not going to treat it. If it was that simple, everyone would have applied and become fine by now. Okay.
Right.
So the first thing, remove this misconception from the mind that home remedies can cure you of a certain condition. Yes, if you have a normal skin and you once in a while like some self pampering, and you want to use something which is available at home, go ahead if your skin is not sensitive. But if you have a condition, don't try to treat it yourself. I mean, I have got people who have used home remedies and come with redness and irritation of the skin. So a big no from my side. Yes.
Fair enough. And what about over the counter medication, topical
Oh,
creams that are so easily available?
so these over the counter medications are spoiling so many skins, I must tell you. So see, in the initial years when we were still thinking of how to treat melasma, there was a regimen in which there is this regimen, but it was used more frequently then. It's called the Kligman's regimen, where we use tretinoin, hydroquinone, and a mild topical steroid over the brown patches, over the melasma patches. So these are used for a limited period of time. But what happened, in India, they became so easily available by so many brand names that women started applying them. They started noticing improvement. And then what happened? They kept using them over years and years and years. So this led to skin atrophy, damage of skin, redness, unwanted facial hair, and also skin thinning. तो देखिए दो चीज होती है. अगर आप ओटीसी मेडिसिन लेते हैं, ओवर द काउंटर मेडिसिन, सो आइदर व्हेन यू नोटिस इम्प्रूवमेंट, यू कीप यूजिंग इट. और अब जब लगाते रहते हैं तो वो बहुत सारे साइड इफेक्ट्स, लाइक अगर 1.5-2 महीने से ज्यादा आपने लगा लिया तो स्किन थिनिंग तो होनी ही होनी है, स्किन सेंसिटिव तो होनी ही होनी है. और अगर आपने स्टॉप कर दिया, लाइक इफ यू गॉट रिस्पॉन्स एंड देन यू स्टॉप्ड इट आफ्टर अ व्हाइल, then there will be rebound pigmentation. Like whatever pigmentation went away because of steroids, it is going to come back. So, I mean, like I get at least 50% of patients who have used some form of OTC preparation, and when they got frustrated or when they damaged their skin, then they came to me to get their melasma treated.
राइट। और आई एम श्योर कि जब इतना कुछ हम करके जाते हैं और हमारी कंडीशंस और ज्यादा खराब हो जाती है, स्किन बहुत ज्यादा थिन हो जाती है और जो दूसरी चीजें आपने बताई, तो ट्रीटमेंट ज्यादा लंबा हो जाता होगा, ज्यादा लेंदी हो जाता होगा।
Yes, that's see. So what happens when people come to me with steroid addicted skin, or if they come to me with an irritated skin because of hydroquinone or tretinoin? Tretinoin is a very potent molecule which can actually irritate your skin if it is used injudiciously. Like आपको बहुत
हम्म।
ध्यान से यूज करना है. So
राइट।
then what happens? I tell them कि पहले मुझे आपकी स्किन ठीक करनी पड़ेगी. ये जो स्किन में रेडनेस आ गई है, ये जो स्किन आपकी हाइपर सेंसिटिव हो गई है, पतली हो गई है, इसमें अगर मैं कोई भी लाइटनिंग एजेंट देती हूँ अभी लगाने के लिए, और रेड हो जाएगी. So the treatment, as you said, gets prolonged because first I have to give creams to repair their skin, and then I have to manage the melasma. Like you cannot be using glycolic acid or kojic acid on an irritated skin. You need 2 to 3 weeks time to first soothe their skin and then go ahead. So yes, the treatment does get
राइट।
prolonged.
तो जहां हमें सिर्फ एक प्रॉब्लम का को सॉल्व करना था, वहां हम 2-3 और नए प्रॉब्लम्स और बहुत ज्यादा
बिल्कुल.
डिटर्मिनेशन के साथ अपनी स्किल को लेकर पहुंचते हैं. सो द बॉटम लाइन इज व्यूअर्स दैट वी नीड टू गो एंड कंसल्ट अ डॉक्टर इमीडिएटली और एज सून एज वी सी समथिंग व्हिच इज नॉट नॉर्मल हैपनिंग ऑन आवर स्किन. कुछ भी प्रॉब्लम है, प्लीज गो टू द राइट पर्सन व्हिच इज अ डर्मैट. डोंट गो फॉर ओवर द काउंटर मेडिकेशन और क्विक फिक्सेस और होम रेमेडीज एक्सेट्रा. कई बार तो ये भी होता है डॉक्टर, हम अपने फ्रेंड या फैमिली से पूछते हैं
Yes.
जिनको हुआ है, एंड कई बार तो हम उन्होंने जो क्रीम्स मे बी दे हैव बीन टू अ डॉक्टर, दे हैव देयर प्रिस्क्रिप्शन एंड ऑल, विल गो टू द एक्सटेंट वेयर दे विल टेक देयर प्रिस्क्रिप्शन, गेट द मेडिसिन्स एंड स्टार्ट ट्रीटिंग आवरसेल्व्स. सो दैट्स
Yeah,
एब्सोल्युटली
that's absolutely true. Like when I asked किसने आपको ये क्रीम बताई, they said my friend was using, उसका फेस तो साफ हो गया तो मैंने भी ये लगाना शुरू कर दिया. So yeah,
तो
that
यही
is.
बहुत सारे वो मिसकंसेप्शंस हैं जिन्हें हमें तोड़ना है, एंड दैट्स द होल ऑब्जेक्टिव ऑफ हैविंग दिस सेशन, सो दैट वी कैन स्प्रेड अवेयरनेस अबाउट व्हाट इज melasma and how can you prevent it and how can you treat it. Now, coming to the prevention part, we always say prevention is better than cure.
Obviously,
How
yes.
can we prevent melasma, doctor?
Yes. So this is a very interesting question which I would always like to answer. So first thing, never think that unprotected skin, you can go out anywhere without applying sunscreen. Your skin has to be protected when you are stepping out of your house. Okay. So there are 4 take-home messages when we say about prevention. First is avoid sun during the peak hours. This is, I'm talking about our Indian context, because we know that during summers the sun can be really harsh. So you
Mhm.
have to avoid sun during peak hours, that is between 10 a.m. to 4 p.m. And if you're out, seek shade as much as possible. Like if you're out on the road and you have an option of standing under the tree, stand under a tree. If you have the option of standing under a shade, stand under a shade and wait. So avoid sun, seek shade. Third is also wear protective clothing. So protective clothing could be goggles, it could be hats, we could be carrying umbrella. And if you're wear full sleeves clothes if you have a very sensitive skin, or if you're prone to getting rashes on your hands when you're exposed to sun, so wear full sleeves cotton clothing. And last but not the least, always wear a sunscreen. Sunscreen is very important. It will go a long way in protecting your skin from melasma. So the sunscreen has to be according to your skin type. It has to be of adequate sun, like SPF, and it has to be applied at least 15 to 20 minutes before going out in sun.
Right.
Besides that, another point which I would like to stress goes a long way in preventing melasma is also hydrate your skin. Hydration has to be internal, that is, you have to drink enough fluid, enough water, and also moisturize your skin with the correct moisturizers. I feel that if the skin is dry, chapped, it is not moisturized, it gets more damaged, or it gets easily damaged by the ultraviolet rays. So these are the things one has to follow to prevent melasma. A proper skin care.
Right, a proper skincare, which includes moisturizer, which includes sunscreen, which includes hydrating your skin from within, which is, intake of adequate fluid. That is really important. Now, talking about sunscreen, doctor, because we have so many, misconceptions again with sunscreen. We'll say that our skin becomes very dull, or I'll start sweating a lot when I use sunscreen, or I don't like the white cast, or my exposure under the sun is not that much. I'm working from home, why should I use sunscreen? Or I'm mostly in the kitchen, why should I use sunscreen? But then we have seen people who are inside or who are mostly in the
Right?
kitchens also have pigmentary issues and melasma. So, what
Yes.
would you like to tell them?
So sunscreen is very important. Again, we have come to a very important section of our talk. See, even if you are not staying in the sun for, say, half an hour, 1 hour, but you're going out, you're getting exposed, you have to wear a sunscreen. It depends on your skin type. As you said, some people would say that my skin is very oily. Never mind.
Mm,
We have gel based, we have water based sunscreens these days, which are perfect for oily or acne prone skin. In fact, we have so many matte finish sunscreens which are very light to feel. The texture is, feathery light. That's what I tell my patient, that the texture of the sunscreen is feathery light. You apply, you would not even realize that you've applied a sunscreen. So don't give excuses for not applying sunscreen. Yes, if you go to the market and buy what is available in the market, you will have a limited option. Like then I will not take the brand names, but then you won't get that range which we have. Okay, but
mm,
if you consult a dermatologist for the type of sunscreen you need, according to whether your skin is oily, dry, normal combination, and what type of sunscreen you would want. Like you would want a light sunscreen which feels light, or you would want something which you could keep on your face and gives some hydration. They would definitely prescribe a good sunscreen to you. There are lots of options these days. In fact, we have water resistant sunscreens also. So that is, if you're going for activities like swimming or you're on a beach, you could apply them and you go. So there can
right.
be no excuse for not applying sunscreen. As for the part of the question where you said that some people say that we're not out in the sun for much, like we just go and then come back,
Mhm.
probably your doctor would prescribe a sunscreen which is, which has a lighter SPF around 30. Would not like to give you something like 40, 45, or 50, but apply a light sunscreen and go. It never harms anyone. And another point that you mentioned was for the people who are staying mostly at home, they're in the kitchen, and also for us who we are all using our mobile phones or our laptops, and we are exposed to those blue lights and all those things. So see, uh, if for them I say, if you're in the house but you have melasma and you're coming to me for treatment,
Mhm.
you will still have to apply sunscreen because you're suffering from melasma, and we want to block out those UV rays totally to give you response. And but if you're at home and you don't have any pigmentary disorder of the skin, or you're not showing very advanced signs of skin aging, sagging, or anything, you can do without a sunscreen, but you always have to use a good quality moisturizer, and that is the bottom line. And probably you can try some natural forms of sunscreen. That is, you can try some good citrus fruits, have fruits which are rich in vitamin C, have salads that contain, like carrots and all have beta carotene. So have a good nutritional status as well. But yes, if you're suffering from melasma, you will have to use sunscreen irrespective of the fact whether you're staying at home, in kitchen, or you're going out. Then you would have to use.
Okay, so sunscreen as per your skin type, as per your working schedule,
Yeah.
routine, etc., is important. And please go and consult with a qualified dermat to get the right one. And doctor, with sunscreen, we always hear that the right amount of sunscreen that we apply is important.
Yes.
The right, how many times we need to apply, reapplication, etc., also plays an important role. Would you like to explain a bit on that as well?
Yeah, so see, for sunscreens to be effective, there is a definite quantity, that is 2 milligram per centimeter square. So, but we cannot measure. So we say fingertip units. Okay. So generally, when you're applying to your full face, we say around 2 fingertips units are needed to apply all over face. This is your finger. These are 2 units, and you apply all over face, and then spread it evenly as a thin film. So that is the amount which is to be applied at one go. You apply that. I always suggest dot method. That is, when you have your sunscreen on your fingertip, just apply it in a circular way in the form of dots, and then spread it evenly all over your face. If a little bit is left, then you can apply it on your neck. Obviously, we're not talking about hands first, we're just talking about the measurement of the face. So that is how I tell. It has to be applied as a thin film all over your face. And if you sweat a lot and if you stay out in the sun a lot, then you need to reapply also. So the quantity of sunscreen also is very important. See, we see in our Indian setup in Indian patients that they apply lesser than that is required. Like sometimes it could be, not even half of what is required for the sunscreen to be effective. So in that case, they might not receive full sun protection, or they might not see full response. So I think our role as a dermatologist also is very important here, so that we tell each and every person who is coming to us for treatment as to how they are supposed to apply and how much they are supposed to apply. That is very important. Then after educating them, it is their wish. If they want to apply less, that's their call.
Right. Now, with that, I'll take a very important question, which has been asked by a viewer, John Burgess, and his question is, can sunscreen alone treat melasma? And with that, I would like to also ask you, what are the treatment options available?
Okay. So sunscreen alone cannot treat melasma. We are using sunscreen primarily first to, stop the melasma from spreading. Once it has already come, we don't want it to increase. So if you use a good quality sunscreen, it is going to stop its spread, number one. Number two, when the UV rays are blocked out, to some extent, the melasma can lighten up, but using sunscreen solely will not remove melasma. Treatment options are multiple. So, as I said, the gold standard was the Kligman's regimen, that is the triple combination cream. But nowadays, more and more dermatologists are trying to do without it because of its abuse potential. Like triple combination will initially give you rapid response, but if the patient doesn't come for follow up and keeps using it, it will lead to deterioration of the skin health. So now we are going to, other lightening agents like kojic acid, then glycolic acid. Then there are so many lightening molecules which are now available, which, and all these molecules are combined in different formulations to give maximum response. Okay, so again, besides lightening agents on the skin, we have oral antioxidants, which includes beta carotene, lycopene, oral vitamin C. These are also powerful lightening agents. Like if you take them in the form of capsules or tablets, and if you're applying sunscreen and using a lightening agent, it will definitely reduce your melasma. But it has to be applied as suggested by your doctor, and it has to be taken for the desired duration. For melasma, there can be no quick fixes. Don't expect हम एक बार डॉक्टर को दिखाने जाएंगे, कोई दवा लिखवा लेंगे और वो सही हो जाएगा. So you have to be persistent. And also we do other procedures like peels, lasers.
Right. So there are other procedures as well. And I'm sure Dr. Melasma doesn't happen overnight, right?
No.
It will start from small patches or spots, etc. So it's important to take care of it right away. I mean, to consult a doctor right away. How
Yes.
much time it takes normally to, restrict melasma, or how important it is to go to the doctor at the very first place rather than, experimenting and doing various hit and trials? How much benefit, or, kitna humko usme improvement dikhega kitna jaldi?
So this is what I always tell my patients. अगर आप थोड़े में आ जाएंगे, आपको जल्दी रिस्पॉन्स मिल जाएगा. आप एरिया बढ़ा के आएंगे, आपको टाइम उतना ही ज्यादा लगेगा. So if you come when you notice a small patch, the time that is needed to treat your melasma is lesser. Obviously, when once you get pigmentation, we do expect you to take the treatment for at least 3 to 4 months. But if you have like extensive melasma, you are having on your forehead, you're having on your cheeks and everywhere, you have to be patient at least 6 months to 9 months. Be persistent, and as I said, sometimes older melasmas which have been there for maybe 10 years, 15 years, 5 years, are treated not only by medicines. We need to do certain peels for them. We need to do certain lasers for them as well. So it is always a combination therapy.
Okay, I'll take one more question. This is by Shania Sain. Her question is, should I use a specific sunscreen formulation for melasma? And also with that, I would like to add, doctor, when we go out to get a sunscreen, there are so many informations on the box. You've already talked about SPF. Then there is this boot star rating, broad spectrum, etc. So what are the basics that we can go for? Plus her question, are there any specific sunscreen for
Yes.
melasma?
So, Shania, when you're going out for buying a sunscreen, we all know it has to be a broad spectrum sunscreen. What does broad spectrum sunscreen means? It means that it has to give you protection from UVB as well as UVA. UVB protection is measured in terms of SPF, that is sun protective factors. If you're suffering from melasma, your doctor would like to prescribe something between 30 and 50. SPF 30 and 50, because the amount of protection we need from the sun or the ultraviolet rays needed in melasma is more. Okay. And also, when for UVA protection, we have a criteria known as PA. So go for PA triple plus. So SPF is for UVB and PA is for UVA. So always go for SPF 30 to 50 and PA triple plus. And also another thing, depending on your skin type, you could, if you have a dry skin, go for lotions. Lotions will give you a little hydrating effect on your skin. But if you have an oily skin, go for matte finish sunscreen. If you have an acne prone skin, go for gel based or water based sunscreen. Everything is available these days. As to your question on what we should look when we are going for purchasing a sunscreen, it has to be broad spectrum. It has to have a good amount of SPF. SPF 30 for anyone who doesn't have pigmentary disorders is good. For people who are having any form of hyperpigmentation, go for something higher than 30. So depending on what condition you have, broad spectrum, 30 to 50, PA triple plus. Yes, these are the things you have to look for.
Okay. We have one more viewer, Rahul Batswar. His question is, can I use a tanning bed or sun lamp if I have melasma?
No,
Um,
definitely not. See, it is, first of all, we have to talk about why we are getting melasma. That's because your skin is reacting or is more sensitive to all forms of radiation, including ultraviolet radiation, infrared radiation, all forms of radiation. So if you use a tanning bed and all those things, it is adding to your exposure to rays, and it will increase your melasma. So
mhm.
at least if you have melasma, first lighten up your melasma, get yourself treated, and then you go ahead with such things.
Okay. And doctor, because most of us have, increased our screen times these days.
Yes.
We work in front of laptops, we have LED lights inside our homes, offices, etc. Are the radiations emitted through these devices, our mobile screen, or these lights, they are also damaging to our skin?
See, this all these things are still in the nascent stage, I would say. We are all studying and we are all researching. But yes, there is evidence that light from our mobile screens, laptops, and the TV, they all add to the radiation which is received on our face. And in the long term, if not hyperpigmentation, they might be responsible for accelerated aging, like the features of aging that you see on the face. They would definitely cause some amount of collagen damage and all. So at least for people who have resistant melasma, who are not, getting treated very easily. Nowadays, I'm also prescribing sunscreens which are protecting from blue light. There are brands which specifically mention protection from blue light. So it will be UVA, UVB, infrared, and also blue light.
Okay. Now, when we talk of melasma, and a patient comes to you with these spots or patches, etc., what test you normally advise for diagnosing, etc., that what could be the probable cause? Are there any tests to go for?
So see, melasma is primarily a diagnosis, a clinical diagnosis. We don't
Okay.
need any blood tests as such,
Mhm.
but when sometimes we need to do a Woods lamp test. Woods lamp is a type of light which your dermatologist would use. It differentiates between the epidermal and dermal melasma. So at the beginning of the talk, I had mentioned that epidermal melasma is more superficial and could go more easily as compared to dermal melasma because it is deeper. So, on using a Woods lamp, if you have more of epidermal melasma, then the Woods light would enhance already, like whatever pigmentation is there, it would get enhanced by Woods light. Whereas if you have more of dermal component, like you have more of dermal melasma, even on using Woods lamp on your patch, there would be no enhancement. So that is the clinical test that we do if we need to. Otherwise, per se, to diagnose melasma, we don't need any test. There are certain other conditions, hyperpigmentary conditions like LPP, lichen planus pigmentosus, and all. For that, if we need to, find out, we do a skin biopsy. Other than that, if you're suffering from any kinds of hormonal issue, then I might refer you to a gynecologist to get your, hormonal test done, or I might send you to get a lower abdominal ultrasound scan done to rule out PCOD. Not many tests actually, more of clinical diagnosis.
Okay, doctor. And
Yeah.
doctor, before we sum up the whole session, any take-home message for our viewers?
Yes, the take home message is we all want to look good. We all want to keep our skin very bright and beautiful. But a bright and beautiful skin is not had overnight. You have to constantly work on it. You, as I said, you have to hydrate yourself. You have to hydrate yourself internally and you have to hydrate your skin externally as well. You have to protect your skin from the damage that we see every day. The damage is from sun, is from pollution. So there can be no excuses for not using a sunscreen. Use a sunscreen for those of you who don't have melasma, who have a normal skin. You have to at least use a sunscreen during the summertime. This is the time if you're working, and most of us are working these days. Even if you're driving a car, there are sun rays coming on your face. So use a sunscreen in every situation. There are sunscreens which have anti pollution effects also. So go to a dermatologist, get a nice sunscreen prescribed for yourself. Last but not the least, if you have a condition of the skin, if you have melasma, don't lose hope. Just be persistent. Your doctor, your dermatologist can treat you, and but they need time to do it. You don't expect miraculous results in 1 month. Be very persistent with the treatment. Don't keep doubting the treatment. Ye kyun de diya, wo kyun de diya, ye kyun bol rahe ho.
Right.
That ways you're not going to go anywhere and you'll be just doctor shopping actually.
Right. So going to the doctor at the first place is very important, and then trusting your
Yeah.
doctor is equally
Yeah.
important.
True,
Thank you
true.
so very much, Dr. Akanksha. It was wonderful talking to you. Thank you so
Thank
very
you.
much for your
Thank
valuable time
you.
and this very informative session.
Thank you. All my pleasure. Thank you so much.
And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Stay healthy, stay happy, and keep spotless, stay glowing. Thank you. Goodbye.
Thank you so much.